The audio working? Oh, here we go.
Yeah, you're good. You're live.
All right. Good afternoon, everybody. We welcome you. Justin Harding, Chief of Staff to Utah Governor Gary Herbert. We're gathered here in the Governor's Conference Room of the Utah State Capitol. We're delighted to have a phone call with you as local elected officials. We have here in the room with us today the Governor. We acknowledge him. Lieutenant Governor Spencer Cox. We also have the association heads for the Utah League of Cities and Towns, Cameron Dill and Brandy Grace with the Utah Association of Counties, and a few of our staff. We're grateful again to be with you today. The purpose of this call is to provide you with information that we've received from the Trump administration in Washington, D.C., as well as other information that we've gleaned from public health authorities here in the state of Utah with regard to the breakout and spread of the novel coronavirus known as COVID-19. This call will enable us to interact with you
on my computer.
We will not be able to have a live interaction due to the high number of participants. We have over 400 people that are actively on the call right now. This call involves all county commissioners and all of the leaders of our cities and towns across the state. We have a link that I believe has been provided to you that you can click on, and you can text questions into this meeting. We will do our best to respond to those. In some instances, we may condense them and respond to a number of them in block. If you are active on the call right now, we would ask that you please press the mute button on your phone or on your computer. Anything that you say or do, even if it's tapping on your keyboard, will be picked up, and that audio will be shared with all of the participants on the call. This is not an on-the-record discussion in terms of the media, but you should please consider anything that you say as potentially being on the record. With that, I'll now turn to our good Governor, Gary Herbert, for his remarks.
Thank you, Chief, and thanks to all of you that are tuned in to us here today. This is a unique time in Utah's history, certainly for me and probably for all of you. The coronavirus, which is a new strain. We don't know much about it. We're learning as we go. This is certainly evolving as an issue around the world and certainly here at home. We've had decades of experience with influenza, which is much more predictable, and we understand that issue much better than this new strain, which is brand new. And I say it is brand new because we don't have any history of this at all. We see on the world map that it's spreading like wildfire. Areas that we thought maybe would not receive it is now receiving it. It's growing exponentially around the world. And it certainly is impacting here in Utah. We have, I think, about 50 different cases now that have been identified. That's growing. That's gone from just in a week's period of time from 1 to about 50 that we have today. So you can see the growth. But we want to do what we can to get ahead of the curve, to slow down the growth and help at least put a speed bump, we call it, in front of this growth to slow down. If we bend the curve, then we save people's lives. And that's the end bottom line for us for what we're trying to address here with this issue. So I'm going to mention a couple of things. I'm going to turn some time to the Lieutenant Governor, who I appointed to be over the task force on this COVID-19 issue, and has been working very hard. We've had numerous conversations with the White House. We have conference calls with my good friend Mike Pence, the Vice President. The President now is joining on those conference calls. And some of the things I'm going to give to you today are really coming from the White House and from their directions to us as governors in our respective states throughout the country. One of the things that they're telling us is we need to act quickly. It's better to be too early than too late. If we're going to have any opportunity to slow this spread down and keep the numbers from escalating, we have options of doing nothing. And the concern is that if we do nothing, then we'll end up looking like Italy. If we do something, then the question is, what is the something we should do that in fact gives us optimism and hope for controlling the health impacts to our population? And secondly, we've talked about the concern about how it impacts our economy. So the health of our economy is certainly a concern for us. In fact, yesterday, as some of you may know, I formulated a group that's going to be chaired by Derek Miller, my former chief of staff, who's now the president of the Salt Lake Chamber of Commerce. And that task force is designed to work with all the people throughout the state and all the different sectors of our economy, say what can we do to minimize the negative impact that's being caused by this coronavirus. So they had our first meeting this morning, and they'll continue to work, and we'll have some information probably in the next couple of days as far as what some of our recommendations are and what we're going to be saying. Last but not least, let me just mention, again, we understand some of the uncertainty out there, and there's just a lot of rumor. There's a lot of myth compared to the facts, and we need to make sure that as government, not only the state government, but our local governments are giving our population, our constituency, the facts as we know them based on science, based on the data, based on best medical advice that we have as of today. So again, we're trying to make sure that all the decisions we've made have been based on good science and good data, based on the best medical evidence we have and the recommendations of those who are really experts in the field of medicine and preventative medicine. That being said, here's what I received yesterday from the White House. President Trump, again, as you know, President Trump has kind of gone full cycle now. He was a little more soft on this before, but he's becoming much more aggressive now as the data is, in fact, informing him. And so he said to us yesterday, guidelines today instructing Americans to avoid social gatherings of more than 10 people. That's much more restrictive than what we've had in the past. And that's for the next 15 days to slow down the spread of the novel coronavirus. That's from President Trump. The new guidelines, he also advised Americans to avoid eating and drinking at bars, restaurants, and food courts, going on shopping trips, which we think is a little bit of an overkill there, social visits and visiting nursing homes and retirement or long-term care facilities. That's where the people are the most vulnerable. The people that tend to be more susceptible, certainly the mortality rate would indicate this, are those over 60 years of age. So for those areas, we really need to be very cautious in what we're doing to protect those who are the most vulnerable to this virus. Last but not least, we want to make sure that we're not just saying the negative things. That's kind of the part of what you can't do, but we want to start emphasizing more what you can do. People can live normal lives. Again, even those who don't go to restaurants and eat in more crowded places, and some of our sport activities, you know, are being canceled now. But there's a lot of other things, particularly in rural Utah. We're encouraging people to look at our national parks, to go to our state parks, to enjoy the great outdoors. Golfing is a great sport you can pick up now and be outdoors. Hiking the trails of our outdoor recreational opportunities. Certainly, grocery stores are going to remain open. This mad panic rush to stock up on water at all. Eggs are still going to be laid by chickens. Cows are still going to get milk. We're still going to manufacture toilet paper. The supply chains are going to continue to operate. So we want to make sure that we start talking to people about what you can do as opposed to only what you cannot do. And you'll find an emphasis on that coming out of the state here in the next couple of days. So we would want that to happen with your voices too as local government officials to talk about the positive aspects of what you can still do. And 90% of our lifestyles are not going to change. And that's good news for all of us. We will get through this storm and we'll weather the ups and downs of this COVID-19 virus. And again, we come from hardy stock and we understand how it is to persevere. We understand how it is to, in fact, to take on difficult tasks and prevail. And we also know that there's sacrifice sometimes involved in that process as we go forward. So with that, I'll turn some time over to the Lieutenant Governor, Spencer Cox.
Thank you, Governor, and thanks to all of our local leaders for the incredible leadership and work that you're providing here. We appreciate your patience. As you all know, this is moving very rapidly. Just in the past week, we've seen tremendous changes in the way that we're approaching this, and the feedback that we're getting from our medical professionals and those at the federal level and the state level. And we want to do everything we can to keep you as informed as possible with what's happening at the state level. We'd actually talked late last week about including you on, we have a community group that meets every Wednesday, and you were to be included on that group tomorrow. However, because things are moving so rapidly, we decided to hold this conversation, and we'll continue to do this with the download. We would like to do this twice weekly. We're still working through our schedules, but we will get back with you as soon as we possibly can with the next meeting, and we'll try to get this on a regular rotation so that everybody just knows we meet the same time multiple times every week, and we'll give you the best and latest. The governor has talked about some of the issues that we're facing. I want to be very clear because there is a lot of misinformation out of there. For 80% of the people who get this virus, it will be very mild. Some of them may not know they even have it. That's good news, but it's also bad news because it means that the virus can spread a lot quicker and a lot easier than some of the other SARS-related viruses and swine flu and those types of things that we've seen in the past. For 20% of us, it will be very serious, will likely result in respiratory infection, and that could lead to potential hospitalization as it turns into pneumonia. That's the most likely scenario for those in the more severe cases. And of course, right now, the mortality rate, the death rate from the coronavirus worldwide is over 3%. And the governor mentioned flattening the curve. You've probably heard that a lot, but let me just re-emphasize why that is so important. We believe we can get the mortality rate down to maybe 2% and potentially even lower, hopefully around 1%. If we're able to keep our medical facilities open and operating, giving us the best healthcare system in the world. What we're seeing in other places like Italy, as the governor mentioned, the news out of New York is not great this morning, is that too often our healthcare facilities get overwhelmed and then we're not giving the best care possible. And that's where you see mortality rates like we've seen in Italy at 6% and as high as 9%. Just to put this into perspective, a normal flu season is 0.1%. So even if we get this down to 1%, that's 10 times higher than flu, 2% is 20 times higher, and of course 3.4% is 34 times higher. In Utah, what that translates into, you can do the math, we have about 500 deaths a year from the flu at 0.1%. So 1%, you're at 5,000, 2%, you're at 10,000, 3%, 15,000, and it goes up from there. So that's really where we are. Now, I want to talk to you guys about testing issues. Testing has been the most problematic issue that we've had thus far with the understanding the spread of the virus. Unfortunately, there were some problems early at the federal level. Those are actually still being resolved. They're working much harder. We appreciate our federal partners in trying to get new testing approved. We have private testing labs here at the state, ARUP, and Intermountain now have been approved. That's the good news. Many of you may have read an article yesterday about a company in the state of Utah that is producing 50,000 kits a day or whatever that number is. They, I believe, have gotten FDA approval today. That's what we've heard, and we should all be celebrating. Except we can't celebrate because there's another problem. All of these tests require a chemical process that's called a reagent. And you have to have this chemical to process the test. And this chemical is not available in the country right now because we're also overwhelmed with this. We're doing everything we possibly can to get reagent, but we're still unfortunately only able to test between public and private facilities a couple hundred tests a day, which is a lot more than last week, but not the thousands that we would like to see. So even though we have, the best way to describe this, I've shared it with some of you, is it's like having a printer without the ink. And so we're getting lots of printers now, but we need the ink, and that's a drawback. And until we can test much more widely, we really won't know how far spread this is. So when we say we've had 39 yesterday or 50 or wherever we are today, the truth is it's probably far higher than that. Because we just don't have the testing capability to get everyone that wants to be tested. So we want you to know that. Here's where we need to go. The governor mentioned the importance of telling people what we can do and what we should do. And this is where we need your help. As we talk of flattening the curve when it comes to our hospitals and the infection rate, we're also trying to flatten the dip in the economy. So we want people to know that we're not shutting everything down. Just because schools have been closed, as the president has recommended we do, and just because we've had restaurant closures in Summit and Salt Lake County and in Grand County, that doesn't mean that commerce and every business has to shut down. So what we're telling people to do is, if you can work from home, work from home. That means work, though. We want work to continue. If you can't, as employers, we need to be creative about how we do things. Social distancing is really important. I mean, staying 6 feet away from people wherever we possibly can, making sure we're implementing good hygiene, we're routinely washing our hands, spraying down common surfaces, and then letting the public know, being creative to let the public know that, hey, our place is a clean place, and this is what we're doing. We should be screening employees as they come to work. If you have any symptoms, if you're coughing, if you have a fever, if those types of things, shortness of breath, you should not be coming to work. And that will help us keep our businesses open and keep the economy moving to the extent that we possibly can. Importantly, we need to make sure the government shutdowns don't kill the economy. And so if in our cities, in our counties, again, we encourage remote work where we possibly can, but we can't just shut down the regulatory process that businesses need to keep going, because we can say, construction industry, we want you to keep going and building houses and implement the 6 feet of social distancing, which, by the way, they can do and they are doing. But if we say you can't get a building permit because we've shut down our offices, then that's going to shut down industry. And so we need to be creative about those processes. Let's think about changing paperwork, making it digital so people can do those things remotely. Let's make it easier for business to happen during this trying time, not harder for business to happen during this trying time. And we need your help in doing that. Let's see, I think I've talked about everything else. Be creative, find new ways to do it. By the way, we are working right now, and Cameron, we talked about this morning. I have an update. We're working with the on a potential declaration. Our attorney's working this up right now that will ease some of the requirements on public meetings. One of the requirements right now to do a remote meeting is that we have an anchor site. We're looking at making a telephone an anchor site, so we don't have to have more people congregated than absolutely necessary. We're also looking for a waiver. Right now, to have a remote meeting, you have to have a policy in place. And while I think probably all of our counties and most of our cities, if not all, have done that, you may have other public entities that have not done that yet. And you can think through some of those, zoning groups, others that need a public meeting but want to hold it remotely. We're working on a waiver that would allow you to do all of those, still have public input, but again, do it like we're doing now via a phone bridge or something like that. So just know that process is in place, and I think we've hit the highlights, Governor, of the things we wanted to.
Yeah, the last thing I mentioned, just while we're talking here, we just got a report. As you know, I declared a state of emergency to allow us to access federal resources to help us get through this easier. We just got approval from the SBA. All counties in Utah are eligible for SBA help and loans, so you all can start looking to that with the SBA. We do have a web page up to give you information. So you can access us for current information. But again, good news, our declaration of emergency has been approved by the SBA. All counties are eligible for help.
And Governor, we will send out a notice to all of our public entities with the details on the SBA loans. It's very generous, and we're hoping to help out our businesses. We've also had questions about unemployment insurance. If you go to the Department of Workforce Services, their website, right on the front page there, they have all of the information on eligibility and applying for unemployment for our workers that are struggling right now. So,
okay, let's hear from Cameron, and then Brandon.
And we have about 9 minutes. So.
Perfect. I'll go quick. I've got 10 questions we've received so far, so we'll see how many we can answer. And if we can't answer them in this setting, we'll follow up with these individuals.
How many have you got, Brandon?
I've just got a few, but and then
Let's
you do.
just
Let's go back and forth. One. back and forth and get as many as we can.
Perfect. I'll start in St. George City with Sean Guzman. He is asking if cities should defer to the local health department in determining whether to close restaurants and other gathering places, or should cities act on their own? Should the State Department of Health make that call for the entire state? Part of the concern in St. George is also echoed in Moab and Park City and other areas where you have a large congregation of tourists that are still coming and potentially overwhelming the healthcare systems there.
And that is a question that we've had as well as the authority, the local health authority versus county commissioners and them having a coordinated effort.
Under the statutes of Utah, the county health department, the regional health departments have jurisdiction. They can say what can be closed and what should stay open. We're going to ask them to develop some parameters and some guidelines on what should be acceptable and what is not acceptable. As everybody probably knows, Salt Lake County has closed at least congregating at restaurants inside. Doesn't mean they can't have a pickup and delivery, curbside service, home delivery. There's other ways to, in fact, dispose of food and put it out to the public for their consumption. But again, part of this avoiding mass gatherings does fall into the realm of going to eating at a restaurant. So we're asking, and we'll ask the county health departments to take a look at that and give us some guidelines and parameters for respective counties. It's already happened in Summit County and Salt Lake County.
You want to ask him? Then
Yeah. This is from Gina Worthen, Cache County Council member. How long do you anticipate closure measures to last, and will they get any harsher? I'm very concerned about the effects to local businesses. And then a follow-up question was economic stimulus that may be helpful to these businesses.
We're all concerned about the uncertainty. It's hard to predict what we've never seen before. People are making assumptions that as the weather gets warmer, that this coronavirus will slow down. We don't see that around the world. So it's a little bit of an unknown factor. President Trump's asking us to do this for 15 days, to not go to restaurants, to close them down. Is 15 days going to be enough? I'm a little leery that that's too short of a time. It would be nice if we could give you some certainty. It may be not 2 weeks, it may be 2 months. But that's what we're working on right now. Again, it's a little bit hard to say, other than we're going to do it probably 2 weeks at a time and look at it now and then review it 2 weeks. That's what we're doing with our public school closing. I'm sure that's what we'll be doing with restaurants. And so we'll just kind of have to take it 2 weeks at a time and hope for the best. And that really is the mantra. We're hoping for the best, but we're preparing for the absolute worst.
And Brandy, if I could, the testing piece of this is so important. If we were able to run, 2,000 or 3,000 tests a day in the state of Utah, we could very likely or hopefully understand where it is and how it's moving and be a little more surgical in some of those decisions. And so our hope and the hope of the professionals is that as testing capacity increases and the speed of testing increases over the next few weeks, that we could see a relaxing of these. But I say that cautiously because I don't want to get our hopes up and then find out that doesn't happen. But to the governor's point, and one of the reasons that he chose 2 weeks a few days ago when he made the first announcement, and we're glad to see the president has decided on that as well, because it's something that the public can handle, right? That they can see 2 weeks ahead of time. And just think back 2 weeks where we were in this. We had a task force, but that was basically it. And then one day, last Wednesday, the Church of Jesus Christ of Latter-day Saints announced that their conference was being done remotely. And then that night, Rudy Gobert got diagnosed and the whole world changed. The next day, the NBA was canceled. And so this has all happened so quickly that we're really just trying to catch our breath right now and follow what President Trump has asked us to do.
But let me just emphasize too, we don't want to overreact. And we think some in the marketplace are overreacting. There's no reason to stockpile water, for example. We have a plumbing system, we have plenty of water, unless you're in a remote, isolated area. But there's a run on that. There's a run on issues with the grocery store, and yet the grocery stores are going to be open. Trump's met with all the major providers. The grocery stores will be open. So we need to emphasize the positive. And again, our decisions are going to be based on the best available science, good data, good medical advice, and we're getting the best that we can around the table to help us in those policy decisions.
Next question comes from Jane Stones, who is in Paraguna. She has a variety of questions. The question I'm selecting is around emergency financial aid for municipalities now that there's a federal declaration in place and we have the pre-existing state declaration in place. You mentioned SBA loans a moment ago, but what are the other processes, or are they still being developed for potential reimbursement to local government or others because of the emergency?
First, we talked with our congressional delegation yesterday, all 6 members of the congressional delegation. There are programs being proposed. There will be a stimulus packet that's going to be hundreds of billions of dollars, similar to what happened at in the Great Recession. So I expect something like that will happen. Will give us some ability to access federal funds and help small businesses, probably some grants. The SBA is going to step up and help with some mitigation monies to help businesses survive during the short term. We're talking to banks. We'll have some reports from what the banks are willing to do here locally, probably in a press conference we hope by tomorrow. So more information will be coming there. The state legislature has appropriated $16 million to our health department to help them with health issues throughout the state for healthcare. We have $4 million that's been appropriated to me to use for emergency operations and needs. And we have another $2 million that will be given to the local health departments themselves for the regional needs that they find. So really everybody has a role to play, local, state, federal, and certainly we're very concerned about the economy and the downturn here. And it's good to see the federal government and the SBA stepping up to help.
We are seeing, as the governor mentioned, there will be additional federal bills that are being discussed right now that are moving through. Some of those processes we are working through right now, and when we have more information, we'll let you know. Probably have time for one more question, and then we'll answer as many questions as we can the next time. So.
Okay, this question comes from Commissioner Painter in Juab County, who yesterday they adopted a resolution restricting gatherings of no more than 100 people. And then saw a regulation coming out about 10. He's wondering if they should go back and amend the resolution too.
We haven't passed a regulation of 10. Most things we have, all we are doing is passing recommendations. We cannot anticipate every scenario, every situation. We know the mass gatherings of people getting together. We've said 50 or less. We've said for those who are over 60 and particularly aged 70 or 80 that have underlying conditions, they ought to be in areas of 10 or less. So it kind of a sliding scale based on the circumstances. We're going to give some parameters and guidelines, but we expect the people at the local levels to use good common sense of what they're doing. For example, you still go play tennis, outdoors, and there might be 4 of you congregated together to play doubles, but that's going to be a good, healthy activity and probably low risk. There's no such thing as no risk. All we're trying to do is minimize the risk as we go through this process of kind of getting ahead of the spread of the COVID-19 virus. So again, we don't have a rule for every situation. We're given some guidelines, and we hope people will implement them. We're going to rely upon the health department. The restaurant issue is probably the biggest one right now because we've closed schools. We're not having mass gatherings at sporting events, et cetera. Our colleges are now doing online learning. The only place right now that really is kind of open is restaurants, where we can have a lot of people gather together. There's going to have to be some guidance there and some restrictions as we see what's taking place. That's probably just going to be a necessity, but we'll leave that to the local health departments to develop some guidelines over a period of time.
So in conclusion, I know the governor read part of this, but hopefully you all have the President Trump's recommendations. Let me just read through those, a couple that weren't read. Work or engage in schooling from home whenever possible. If you work in critical infrastructure industries defined by the Department of Homeland Security, such as healthcare, pharmaceutical, and food supply, you have a special responsibility to maintain your normal work schedule. You and your employer should follow CDC guidance to protect your health at work. Avoid social gatherings in groups of more than 10 people. That's where the 10 came from, was from the president's recommendation. Avoid eating or drinking in bars, restaurants, and food courts. Use drive-through, pickup, and delivery options. And we really want people to use those and support our local businesses to keep them open. If they can't do that, the governor's wife did something awesome yesterday. She was scheduled to go to lunch with her friends for her birthday. And with the restaurants closing, she bought a gift card at that restaurant, which gives them them money and gives her a chance to eat later on when they're open again. Avoid discretionary travel, shopping trips, and social visits. Do not visit nursing homes or retirement or long care facilities unless to provide critical assistance. Practice good hygiene. Wash your hands, especially after touching any frequently used item or surface. Avoid touching your face, sneeze or cough into a tissue or the inside of your elbow. Disinfect frequently used items and surfaces as much as possible. So that's from the president, and we're doing everything we can to follow that. Thanks for the questions, Governor. Any final words?
No, we can get through this together. It's going to take a little bit of sacrifice, but a lot of cooperation.
And what time do they call in tomorrow?
We will not have a call tomorrow. We will schedule a call for later in the week. It will probably be Thursday or Friday for our next follow-up, but we'll get that right out to you. Thank you, everyone.
Thanks. Good luck.